This is the Jungle Jim Hunter Show, only on the Fan 960, Calgary's only all-sports radio.
Any training that does not include the emotions, mind, and body is incomplete. Knowledge fades without feeling. Think about it. Did the ability of the athletes playing in the Stanley Cup right now, did it change? Did the level of fitness change? Did the skill development change? No. What changes is what's going on emotionally in the mind of every one of those athletes. It's their emotions, it's their feelings that change. Just because you're trained for something doesn't mean you're prepared for it. That's why there's so much more to just physical training. Training is useless unless you have a purpose. And it's knowing for what purpose to train that can break and beat and lead men to fulfillment. It's a quote from an anonymous source. Mark Twain said this: there's nothing training cannot do. Nothing is above its reach. It can turn bad morals to good. It can destroy bad principles and recreate good ones. It can lift men and women to angelship. I don't know what he meant by angelship, but when I read that, I went, it's a good point. That's what training does. I said to one of my listeners who wrote me last week that I would give a public apology on the air for my comment last week about saying that don't ask us dumb questions. You're right. There is no dumb questions, and sometimes your mouth gets ahead of your mind, which in that case it did last week. So we all make mistakes, so I hope my listeners will forgive me for getting my mouth ahead of my mind for a change. But I think you get the point that when you get the opportunity, what are you asking the person you're asking? Make sure that you ask them something that is going to further and help you develop your child, develop yourself, and develop a better country, a better community, better people. Well, this is kind of special. Lisa, we have a very special guest. This is Christina's friend, and we wanted to have him on because Christina pointed out to me that we talk to therapists, we talk to psychologists, we talk to trainers, but we've never talked to a chiropractor. And chiropractic is part of training and developing sport. And she knew this gentleman and said that he's outstanding at what he does. His name is Dr. Murray Rosen. He graduated from the University of Calgary in 1980 with a Bachelor of Science degree, magna cum laude, which is just big words that I don't understand. But obviously it means that he knows what he's talking about, and he does. And you got to get this, Lisa. This is quite amazing. He is the guy associated with the Saddle Dome. In other words, his responsibility with the Saddle Dome and the Jubilee Auditorium and Jack Singer Concert Hall is that if somebody comes in town who needs treatment, he's the guy they go to, right? So he's treated people like, well, I'll start with hockey players first. Mike Vernon. He's treated figure skating stars, all kinds of figure skating stars, bands, rock bands, the John Fogerty Band. I mean, I don't know, the Black Eyed Peas, he's treated them. Stephen Winwood, Brooks and Dunn. I mean, he's had something to do with a lot of people. So he's the go-to guy here in the city. He's the guy you go to. Murray, welcome to the program.
Thank you. It's nice to be here.
We wanted to have you on today to talk about a side of sport that some people don't know or a lot about, and that is how it's helpful to the benefits of having a chiropractor work on your body when you're trying to be the best in the world. So why do we need a chiropractor?
Well, the big thing is in chiropractic, we're all into the mind-body connection. We want the brain to communicate to the best of its abilities with the body. And that's what we do in chiropractic. We remove nerve interference to make the brain work better with the body. So you're going to run faster, you're going to jump higher, you're going to throw harder, you're going to reduce your likelihood of getting injured. And if you do get injured, we're going to increase the ability that you'll heal quicker.
Okay. So what are some of the benefits an athlete would get from using a chiropractor on a regular basis? Because I know there's people out there that would say, well, I'm going to go to a massage therapist or go to a therapist. But where do they decide, or how do they decide why they need a chiropractor?
Well, we have massage therapists in my clinic, but the rule in my clinic, Jim, is you have to get adjusted before you go into the massage therapist, because muscles are passive. They don't work unless the nerves that control them are working. So we remove the nerve interference, and they get better quicker. Like I said, they run faster. It's all been proven. It's great for the athlete.
Is there a catchphrase? I'm curious. I use one with my athletes that's called, it all relates to flexibility, and I say that a fast athlete is a flexible athlete, and a flexible athlete is a fast athlete. And I've shown athletes how if they just don't have the flexibility they need, that they're naturally going to be slower than their competition. How about in the chiropractic world?
Well, that's great. Flexibility is so true, but how can you be flexible if you don't have motion in your spine? And that's the big thing with chiropractic. We install motion back into the spine, and as a result, then again, we remove this nerve interference and get them functioning better. The key word in my clinic is function. Okay.
Connect all the dots for me, because I'm curious to know how you use these practices to complement each other, because you have your general practitioner where a mother and a father might take their child and say, he's got an ache, he's got a pain, and the doctor goes, you need to go see a massage therapist. But maybe he needs a chiropractic service, but maybe the doctor's not connecting those dots. So help me understand how all of the different facets of training an athlete connect to chiropractic.
Well, that's a great one. The biggest thing is I started adjusting my kids at birth. I don't think there's anything more traumatic than the birth process. So we make a joke. We see people in my clinic from birth to death, and then about 1 week after that. You got to get adjusted. It's not really big in Canada yet. I mean, my buddies are all NFL team chiropractors. One of my own patients moved to Texas after he became a chiropractor. Now he's the head PGA Tour chiropractor. So all the different disciplines have their place, but I'm drugless. I mean, I don't think the body was born with not enough drugs in and too many organs, so I'm going to fill you full of drugs and remove all your organs. Yeah. That is not health, Jim.
Yeah, to me, it's not either. I agree with you totally. You're listening to the Jungle Jim Hunter Show on Sportsnet Radio, the Fan 960, thefan960.com. This week, we're talking to chiropractic expert, Dr. Murray Rosen. He's here in Calgary. He treats people from, well, as he said, from birth to death, and anybody, but he's primarily the guy that they go to whenever they come to town in the Jack Singer Hall or the Jubilee Auditorium or the Saddle Dome. So he knows what he's doing, folks, and you have to listen to what he's saying. Dr. Rosen, we're seeing younger and younger athletes training with more intensity, and parents might be reluctant to take their child to a chiropractor as much as they may need it. They may be reluctant, but because of the development of athletes training at younger and younger ages, when you've said that you take them at birth, but convince a parent for me of a 12-year-old or 10-year-old that they should bring their kid in and have them adjusted.
Well, one thing, a lot of people are scared because they think it's going to be painful. I mean, the kids come in here, they can hardly wait to get adjusted. They think it actually tickles. And the big thing is, as the trunk grows, so does the tree. I can't remember that saying. If you want to get these kids before their growth spurts, to make sure they're growing straight. Mm-hmm. And the same thing, Jim, is removing nerve interference. Yeah. And there are the three causes of nerve interference. It's the physical stress, the chemical stress, and the emotional stress. I mean, our society now is crazy. We're eating all this junk food. The kids are stressed with everything in life now. Things have changed since I was a kid.
Yeah.
And then you add the physical stresses of an athlete, and you've got all three.
Yeah. When you add those up together, it just puts way too much stress on the nerve endings to begin with, to say nothing of whether you're out of alignment or your body isn't aligned with a posture or a stance that is healthy.
So true.
Yeah. Can a parent tell if their child needs to go to a chiropractor, a massage therapist, or a doctor? Which one should they go see first, or can they tell the difference?
I don't think parents can tell the difference. I think each discipline has their own little niche, and we all got to start working together in Canada a little bit better. No one's any better than anybody else, but when it comes to kids, my idea is you don't want to give these kids drugs. I mean, us as adults are what's causing all these little kids into the drugs. Mm-hmm. You give them drugs that mask the pain, and then they really go hurt themselves.
Yeah, my dad's solution to ADD and HDD was to have me work very hard.
So true. You know that 80% of the world's Ritalin is sold in North America.
Yeah.
You know, how bad is that?
Yeah. And I know there are people out there screaming right now going, you don't understand. My parents understood me very well. They understood that I was driving them crazy all the time because I'm so intense about everything, and I'm so wired to just go. And my dad just said, you know what? If I keep him active every day and I keep him focused every day, and he always had a plan for it. It wasn't like he said, gee, this kid is weird, let's drug him down and make him sit around and read books. It was, let's figure out how to take that energy and do something with it. And I think that we lose that. I think that we forget that we can do something.
That's so perfect.
Women remain active in pregnancy now, much more than they used to. I know some that, are still running 10K races right up until the 9th month. Should they go see a chiropractor?
Jim, there are so many studies out there that say, sure, there's the pain relief from going to a chiropractor when you're pregnant, but there are studies that show that we reduce the likelihood of C-sections by keeping the pelvis, more likelihood of getting full-term pregnancy. It decreases the nausea. And when we go back to saying preventing C-sections, think of the money. Alberta leads Canada in C-section rates.
Is there a prevention therapy that a person can do to help themselves if they can't get to a chiropractor right away?
Well, like you said it right there, activity, core training, all these things with the BOSU balls and everything now, all the personal trainers, it's all core.
Mm-hmm.
And eating well. I mean, you always got to move well, think well, eat well. That's the big thing. We eat like crap. Everybody sits on the couch, doesn't do anything, and they have bad thoughts. Clean up your mind.
You could coach athletes with those words.
I wish.
Because I know athletes that they basically eat junk food and sit around and complain about how out of shape they are and think that they're never going to be any good. And it's, you can just reverse that process pretty simple.
So true. Like I said, a good mantra, eat well, think well, move well.
Yeah. Do you have any interesting stories to tell us about somebody you've treated? I'm curious to know if you've ever had to treat somebody that was quite humorous or interesting.
Well, I think humorous, I got to adjust Russell Peters, and that guy is in joke mode 24/7. That was a blast. Russell was great. Roger Daltrey, who was an idol of mine when I adjusted him at the Dome, I think what he said to me is the only reason I can still rock and roll at 62 years of age is because of you chiropractors.
Wow.
That was great. Mick Fleetwood, Fleetwood Mac, he was going to cancel the show. He had such a severe migraine, and I adjusted him before the show, and it went away right away. And then the next morning I came to work, and one of my receptionists goes, I think you've got a prank call. There's some lady that says it's Stevie Nicks on the phone. So
wow.
I take the phone. It was Stevie Nicks, and she said, whatever the hell you did to Mick last night, do it to me. So I went to the hotel and adjusted her.
Wow.
That's fun.
Yeah. Well, you're having a lot of fun doing this, aren't you?
I absolutely love what I do.
And where are you located?
I'm on the corner of Elbow Drive and Glenmore Trail. My clinic's called Calgary Spine and Sport.
Okay. And is there a website people can go to?
Yeah, www.calgaryspineandsport.com.
Wow.
Great website. That
is great. Hey, thank you so much for coming on, Dr. Rosen.
This was an absolute pleasure, Jim.
I really appreciate it. I should come and see you. You just set me up, and I'm feeling guilty now.
Well, I wish you would come and see me.
I got hurt in 1980. I fell in a downhill crash at I was doing about 75 mile an hour, mm-hmm. and I ended up coming home in a stretcher. And I came home from Europe, and they treated me at the hospital, and they couldn't find it, and basically hung me upside down every day from my feet to mm-hmm. release the pressure on my spine. And I have this funny thing where the nerves on the outside of my right leg, right down to the above my knee, all of that part of the skin is dead. In other words, it doesn't feel anything. I freak my kids out because I can put a pin right through it, and it freaks them out.
I treat that a lot. I wish you would come and see me.
I'll come and see you.
We've got a really cool technology in my clinic. It's called an Insight 7000. That really was invented by NASA, and it's just this computer that runs down your spine and tells me where the nerve interference is.
Wow.
It's so state-of-the-art. It's a very cool machine.
Hey, thank you so much. We appreciate you coming on.
Pleasure.
I'll say hello to Christina for you.
Thanks.
Thank you so much.
You're welcome.
Dr.
Bye-bye.
Murray Rosen, folks, he's here in town. He helps people relief from pain.